Welcome back to Western New York Living. For years, Buffalo Vascular Care has specialized in the diagnosing and treatment of vascular and non-vascular conditions. Their practice centers around providing the highest level of service to their patients. Joining us this morning from Buffalo Vascular Care is Dr. Azher Iqbal. Thank you so much for joining us this morning.
Good morning. How are you?
Why don't you start? I'm good, thank you. Let's do an overview of what Buffalo Vascular Care has to offer its patients.
Very good. Buffalo Vascular Care has been in business now for about a year and a half. Mm-hmm. It's in response to changing expectations in the medical field. Buffalo Vascular Care is a treatment facility that offers diagnosis and treatment of diseases all under one roof.
And you're an interventional radiologist, board certified, which for me is always so important. And that has really changed to the way medicine is done today, hasn't it?
Indeed. So Buffalo Vascular Care has its own cath lab where we do all our procedures, mm-hmm. And we have other related facilities, including recovery, etc.
There's a specific condition called uterine fibroids. What's this condition? What are some of the symptoms?
Uterine fibroids are actually the most common benign tumors mm-hmm.
Found
in females. There is a genetic predisposition. Certain races are more prone to have fibroids, such as African American and Oriental women. About 1 in 3 women will have fibroids in the uterus.
Wow. And that's a high number, and they can be very painful, correct?
Indeed. By the virtue of their size and location within the uterus, they can cause pain, they can cause dysmenorrhea or increased bleeding during menses, mm-hmm. to the point that a lot of women I've treated have become anemic, mm-hmm. Difficulty to conceive, etc.
Mm-hmm. And if you're watching right now and you're dealing with uterine fibroids, the amazing thing, the treatment's changed drastically. Where it used to be surgery, now it's an in-office procedure done through the arm. Tell me how it works.
The procedure that we offer is called uterine fibroid embolization. It's a very advanced endovascular procedure where we guide small catheters into the blood supply going to the uterus and to the fibroids. Mm-hmm. And then we block that supply, causing the fibroids to scar down and involute without surgery.
That's incredible.
Unfortunately, surgery is the most common option which is offered to women who have fibroids which are symptomatic, which may include removal of the entire uterus or removing mm-hmm. fibroids. And surgery has its own risks, and it's a hospital procedure, and the patients are typically laid up for about 4 to 6 weeks.
Versus if they were to have the embolization, how long are they laid up?
It's quite a difference because patients would usually walk in the morning and they leave in about 4 hours.
Amazing.
And they're typically able to go back to work in about a week.
How would they know if this procedure would be right for them? Do they come in for an evaluation?
Indeed.
Mm-hmm.
This is a great procedure for anyone who does not want to have a major surgery to treat their fibroids and is not looking to get pregnant.
Excellent. Thank you so much for being here. I'm fascinated by this and the statistic of 1 in 3 women. You think about how many people this will benefit. Thanks for being here today.
My pleasure. Thank you for having me.
If you want to find out more about these treatments they offer for uterine fibroids at Buffalo Vascular Care, head over to the website, which is viabuf.com. There you'll find information on all the services and conditions they treat. You can also give them a call at 852-1977 to talk to their staff and set up an appointment. It's Buffalo Vascular Care, located in Lancaster. Well, there you go. That's a wrap for our show for this Saturday. I want to thank you all for tuning in. Remember, catch Western New York Living again every Monday morning at 11:30 when we bring you a new show filled with great guests. Enjoy the rest of your weekend. We'll see you soon. Bye-bye.
Special consideration for today's show paid for by the following: